You've heard that exercise can help keep your brain sharp as you get older, but can it reverse the march to decreased brain function or even dementia? Or does exercise simply slow the inevitable? And what are the best exercises to do for the brain? Well, Dr. Raj is an assistant professor of geriatric medicine at U of L, and I hope he has some answers because he's going to help me out to keep my brain function from deteriorating. Dr. Raj, welcome to the program. Appreciate it.
Thank you, Mark. I appreciate the opportunity to be here and speak to your audience.
All right. What's geriatric medicine? What do you do? Explain. How do you explain it to people?
The simplest way I end up saying it's in the opposite end of pediatrics.
So you tell them it's for old people like me? Is that what you say?
People who are older.
People who are older. And, seasoned. Somebody on my show last week called it seasoned. He said he was seasoned. He wasn't old. He was seasoned.
Absolutely. We don't want to stigmatize or put people in a category just because they're getting older. It just means just as when you have a young kid, you are paying extra attention. You make sure they go to the baths. Similarly, as we get older, we do need to treat our body with respect and adjust and adapt to how we function. If we try using the same medication at the same doses or don't take care of ourselves properly, we pay a price.
Yeah. Okay. Well, I think most of us know if you exercise and you routinely exercise, it helps you potentially live longer, helps your heart and those kinds of things. I think what people perhaps don't know as much about is what should they be doing in terms of exercise that helps their brain, and how does it help your brain? So why don't you talk about that a little bit?
Thank you. This is actually quite exciting research. In the research community, we do know exercise does so much more beyond just making the heart stronger. But out in the public, quite often, people okay, you hit the gym, you exercise, you can build big muscles. However, beyond improving the health of the heart or the blood vessels, maybe improve mood, most people are not too sure what it does for their brain. So research shows that exercise is one magical compound which can actually strengthen the brain and, in fact, build more brain cells. In one of the exciting research studies, they actually checked pictures of the brain, if you may, and they followed people for over a whole year. And these are people who may or may not have exercised in the past, and they are not spring chicken either. So the participants in the study were 60 years or older, and they put them through aerobic exercise up to 1 hour in length twice a week. But they persisted. They did that over a period of a whole year and compared them to others not doing exercise. And what they showed was the scans showed improvement or maintaining of the size of certain parts of the brain, which we believe is critical for memory. And this is huge because if I have patients, people stop me on the road all the time and they're like, Doc, I saw this on TV. Can I take this? Will it improve my memory? But here is something we know that can help make your brain not even stay the same, but become younger.
Wow. So yeah, that's what I was going to ask you. So these folks that are working out and doing some exercise, not only does it stop the deterioration of the brain, it can actually regenerate and help improve the size of the brain. What's it called? What do you call it? The hippocampus, I think. Is that what it's called? Something like that?
Very close.
The hippocampus?
The hippocampus.
Hippocampus, yeah. So it can actually help your brain regenerate. Does it regenerate the cells that are in that portion of the brain, or what does it do?
Right. A lot has changed. When I was going through medical school back in the day, we were taught that the brain is unfortunately one of those organs that does not grow in size. You're born with a certain number of neurons, and as you get older in life, you keep losing cells. However, over time, it's been shown that certain parts of the brain can regenerate, maybe not to the extent of certain other organs. However, exercise is one positive force that can promote the good chemicals that lead to those changes.
Wow.
And in this particular study, normally the hippocampus, every passing year beyond a certain age, we lose about 1% of the volume. But participants in this study, they showed the size of their brains were comparable to somebody 1 or 2 years younger to them. And this is just over a period of 1 year. Who knows
what it
when
does
this
over 2 or 3 years if you keep exercising. All right. We're talking with Dr. Raj. That's how he likes to be known anyways. Dr. Raj, he's an assistant professor of geriatric medicine at U of L, and we're talking about exercise and what it can do for your brain function as you get older. For folks that are over 60 then, what should we be doing? I'm getting ready to hit 60 this year, so how many times a week should I be working out? What kind of exercises should I be doing? Tell me.
Absolutely. There is no set routine for everybody. So for the people who are new to exercise, they're just used to being in the couch all the time. First disclaimer, you do talk to your doctor, make sure you're healthy otherwise to engage in physical
Don't go out and run
exercise.
2 miles if you're 80 pounds overweight. Is that what you're trying to tell me?
Baby steps, baby steps. So compared to how active you normally are, if you're able to challenge yourself and increase, so let's say I'm not used to walking. The most I exercise my arm going for the remote for the TV, then I would probably start off with, okay, I will start walking 10 minutes at a time, and maybe twice a week to begin with. When that becomes too easy, or if we stick to it over a period of a couple of weeks, we can then start doing that pretty much every day. Ideally, most of the exercise programs we look at, they want us to work out about 150 minutes or so in a week. But more recently, we have several studies come out asking the question, what is the bare minimum I have to do to get benefits from exercise? And the answers have been quite surprising. Not everybody has to be in the best shape to run a marathon. As far as working out even 10 minutes a day, walking seems to give substantial amounts of benefits compared to not exercising
doing anything,
at all.
yeah.
But for the athlete who's older, who is used to taking care of their body, they could go much farther. In this particular study I was talking about, which showed a benefit in the size of regions of the brain, important in memory, for instance, people were engaged in aerobic activity. Aerobic activity might sound fancy, but at the end of the day, it's anything that raises your heart rate, makes you sweat a little. So
just going out at the lunch hour, if you're on your job and you go out at lunch hour and you walk a mile up to the store and walk a mile back, that'll get your heart pumping. That's good, right? That'll take you 10, 15 minutes.
We will take that, and thank you for that. That is a wonderful suggestion. When the weather is nice, any one of us can engage in that. We can, and it'll. And if you need the doctor to write you an order, get away from work for half an hour, take a nice walk. I think that's doable.
Okay.
And that would actually put you on the path to the main. Trick is trying to incorporate it several times in a week. If you get to the point of doing it up to 5 times in a week, that would be
So
excellent.
any kind of exercise to get your heart pumping, it will help your brain function as you get older. That's the bottom line.
That is the bottom line I would want you to take from
Okay.
this. Yes.
All right. Again, we're talking with Dr. Raj, who's at the University of Louisville. He's an assistant professor of geriatric medicine. Does it impact men or women differently? In other words, do men have to work out more each week than women do to have the same benefit to their brain?
Actually, in my readings, it appears to be similar. Both men and women gain improvements. In fact, the people who gain the most from exercise are people at higher risk of developing memory problems. For instance, if you have a parent who has dementia or a debilitating memory disease, then if you start taking care of your body when you're in your 40s, 50s, or 60s, you're in much better shape when you turn 85 because you've already built up the blood vessels in your brain. You're perfusing the brain much better, and you're setting yourself up for much improved health.
Okay. Well, I go to the gym 3 times a week and do the elliptical and do some weights and stuff and walk around. But I don't do enough on those other days when I'm not. I don't do enough. So, and I'm about ready to hit 60. So I guess I'll take your advice and maybe try and go for a walk at lunchtime every once in a while. That would be good, right?
With friends, not just physical exercise. There are many different things people can do that can improve on their brain health.
Get a workout pal.
Absolutely.
Or a walking pal.
That helps you stay on track and also helps with the socializing aspect, because that is another huge area of strength as we get older.
Okay.
People who socialize in a meaningful way, they are much happier and healthier.
All right, Dr. Raj, appreciate you being on the show.